How's the practice?
Very good. Practice is going well.
Awesome.
Right now, what is taking up most of my time is on the 16th, I'm doing a TED Talk.
Oh, really? Oh, my goodness.
And as like, you know how they say, like, if you think about it and like say it, then
it's going to come to fruition.
Yeah. Last year, I had met a friend and I was like, oh, it'd be cool to do that. And I'd mentioned it and then
the universe
got
said,
nominated.
All right, girl,
Gotcha. And when I heard that I was going to do it, I was like, oh my gosh. Excited, nervous, but now definitely nervous.
Okay. Now that it's like...
Because it's 2 weeks away. Yeah. So...
Congratulations. That's exciting. Where's it going to be held? Where's the TED Talk?
It is in Wilmington, Delaware.
Oh, okay.
There's like a health and wellness salon there.
So you have some distance to get nervous on the way over there.
Yeah. I think I'm going to go a night before.
Yeah.
And then it's on the next evening.
Okay.
So hopefully it'll work out.
Enough time to breathe.
But yeah, so like people ask me about practice, but this year's like goal has been to like develop the teaching, the impact, community impact, or like the professional impact.
Tell me a little bit about that. What do you mean?
So I felt like, I had my baby, then COVID.
Yeah.
And then people were just like in like that survival kind of mode. Yeah. And I was in the same way, like balancing being a mom, being a dentist, being a business owner. And I kind of just felt like I was in such a, like a bubble where I was just protecting my feelings, protecting people's feelings, protecting my patients, protecting, But I feel like this year I was like, I can do all that, but I should also work on growth and not just in like the hunker down and let's survive type mode. And one of the things that I used to do quite a bit, and I know we met first because of it, is I used to do a lot of like teaching, lectures at Children's Hospital, in the community and everything. And I kind of felt like I had gotten away from it in the past few years. So 2023, I was like, 2023 stress-free.
Yeah.
And growth. Yeah. And so I said, I'm going to go back to teaching. I'm going to
Does that make you excited?
Very much. It makes me...
Every time you say teaching, you're like, I'm going back to teaching.
I know. And I think that there are a few things that sometimes that come off like so naturally. Even like people who are like meeting me after such a long time and they're like, that's what you want to talk about? I thought you were talking about your business, right?
Yeah.
But I feel like that is so intertwined. Like I feel like my business was... The reason I had to open my business, I feel, is because I felt like what I was offering, there was not a space for it in other practices. And I had worked in other practices before, but I was catering to moms and special needs patients and newborns and stuff. And that just doesn't fit in the, like a traditional dental thought process, right? Yeah. So people don't expect that they'll go to a pediatric practice and they'll actually see babies like before teeth come in. Or, cleaning and fluoride is not our practice philosophy. It's more about like education, experience, and all that. So I kind of felt like I had to open my business for that. But then the other part was education of parents and experience.
Explain to the audience that's listening right now, what is it exactly that you do? Because
I
know.
I am a pediatric laser dentist. So I provide like specialized care. It's, more than just cleanings and fillings and things. It's about overall health, like comprehensive care. And we take care of babies as young as 2 weeks old. No teeth. And who are having feeding difficulties. And I take care of, and we evaluate mouth function, we evaluate whether they have good suck, swallow, breathe technique, are they able to feed well, whether it's on mom or baby. So that's like, out of the 3 major things that our practice like specializes in, that's like one big chunk. The other thing that we do in our practice is a care for special needs patients. So some of these patients, and especially in like COVID, it became very, very apparent how our community is kind of lacking in those resources to give help to patients that might need that additional help, not just every 6 months. Go get a cleaning done, get your little token and come home. It's those kids that actually parents have a hard time getting inside the mouth. Those kids need a little bit more help getting to the dental chair.
Yeah.
At least once a week, I have done some cleanings right on the floor.
Yeah.
Or in the play area.
You meet them where they're at.
Yes, exactly. And that's not possible in like a traditional practice easily, you know?
Yeah.
And then the third is the toddlers, the babies that have teeth, but they're just like pre-cooperative. Like they're just not ready to just go and come. They need a little extra time. They need extra toys and like familiarity. They need to feel like they came to a familiar, non-threatening place. So younger kids, special needs patients, and moms and babies.
I think adults need that too, by the way.
You are right. You are right. And so many times parents say, do you see babies or you see adults also? And I'm like, I see only real children.
Yeah.
Not all of us who want to be children all our lives, right? So, yeah.
Now, you said laser dentistry. What does laser dentistry like consist of?
Okay. So laser dentistry is like is the type of dentistry that does not focus on using the handpiece, the drill that we think about. It's a technology. I think it is at this point 25, 30 years old. It started out with other industries. You know, everybody thinks about LASIK.
Yeah.
It's similar, but it's dental wavelength that works on teeth and soft tissue of the mouth. So that way, when kids have cavities, they don't have to get that, you know, the dreaded shot.
Yeah.
The dreaded shot, the dreaded drill. So when a child, you know, has a filling that has a cavity that needs a filling, the first question is how are they gonna, you know, tolerate that? Yeah. And when I can look at a child and say, it's not gonna be a shot.
Yeah.
Right there. Yes, right there. I see the difference in their like, okay, I can handle this. So that's the biggest thing. The fact that it allows me to take care of soft and hard tissues is another thing because, you know, sometimes we think of anything that is outside of teeth. You need to go to the hospital or the surgeon or, you know, like an ENT or something. However, it's inside the mouth. So the dentists have the most training and education about like the function of the mouth. Yeah. So being able to offer that in a familiar place to my patients, non-threatening, not in a hospital, has been.
What are some of those popular things that you treat in
Oh,
the mouth that's not
lip and tongue tie. You know, it's the connection between the upper lip to the upper jaw or the tongue onto the floor of the mouth. The connection's called a frenulum. And when that frenulum is too tight or too thick or too strong, restrictive, you can't use your mouth and your tongue really well. And what happens is the impact of it can start as early as infancy. So difficulty with feeding, breastfeeding, bottle feeding. As they grow older, difficulty with, you know, textured foods. Chicken nuggets are okay, but grilled chicken is harder. Yeah. Those type of kids, you know? Yeah. And then as that tightness or restriction continues, there's clarity of speech concerns. Those kids can have more cavities. And most importantly, in the last 10 years, we have found out that not being able to have a good posture in your mouth can lead to sleep disturbances. Mm. And so bedwetting, night waking, mouth breathing, snoring, all of these things
it's
can
crazy.
be tied.
It's all connected together,
all
right?
Connected.
That's wild.
And so having the ability to help it early on has been such a fulfilling part.
And why did you
even get into it?
This specific. I know you touched on it a little bit, but
yeah. And I don't talk about this often enough, but you know, I was a dentist, and then I specialized in pediatrics. And then I was introduced to lasers as a modality of doing treatment. And I used to provide the care being a type A personality, you always want to make sure. So you go to school and you go to the specialty, but then you're like, that technology, and I might be dating myself, was newer when I first started practicing, right? So I did all of that education and I would provide care. But when it really hit home was when I had my baby. And he was having feeding difficulties. And as a doctor, you felt like I should know how to do this better, right? Am I doing this right? And he had like the hardest time. I mean, he lost close to 10% of his birth weight. He had to be observed. Even at like 2-week checkup, he did not meet his birth weight again, and that became a problem. And then the lactation consultant was the first one that kind of reminded me, don't you, are you Dr. Rishita Jaju? Don't we send these babies to you?
You're like, maybe.
And, honestly, I was like so vulnerable, like so postpartum, so like hesitant, right? I was a first time mom, late bloomer. I'm like all types of external and internal judgment, right?
Yeah.
And I was like, don't call me doctor. I don't know anything. Just tell me and tell me what I need to do. And she was just like, these are the babies we send to you. Do you think he has a lip or tongue tie? And like my heart dropped, but I was feeling like such a...
Yeah.
And I take him to my office, and I kind of had to like wear my gloves and wear my jacket to kind of feel like I'm doing a professional evaluation. And he had all the signs of lip and tongue tie. And I'm like, I've been practicing on everybody else. And I was so busy being like this mom that was failing at being a mom or failing at feeding my baby. No one had even checked inside his mouth. I took a look. We found out that there were all the signs of a lip and tongue tie for him, right? And then I take care of him and I work closely with the lactation consultant. And within like a week or so, he's doing better. Anytime that would happen, everybody, but he looks okay. And, he just doesn't like feeding on you.
Thanks, Sally.
Yeah. And it would like be like a stab in my heart, right? Like, I'm trying so hard here. And the whole, like, it's like the feeling of rejection, right? And of course, it was more emotional at that point. And like now when I'm talking about it, it kind of like, I relive that a little bit. But
sorry, PTSD.
No, I know. But when he started doing better, and like now as I'm like coming out of that like fog, that is my biggest mission, because I'm like, I was a mom that kind of had the resources. I kind of knew about it, but because it wasn't something that the doctor said, like the day that they said we need to take him away for observation, like, but why? Right? Nobody said that. So now I feel like if I'm going to make an impact in the community, it's going to be, let's bring this up. Like, let's make it so that doctors have the science, the families have the science, that talk about it's one of the more minor things that we can do compared to all the other things that newborns can have. So I understand like doctors have a lot to kind of worry about in newborn care, but if there is a mom that is having a hard time with feeding her baby, instead of going in like the consoling part of being a doctor, we need to go in a little bit more of an investigative part, right? Like give that mom some timeline, give her some resources to look into, why is this hard? Or is this truly going to be transient? Give her the right thing. Just don't be like, oh, it happens, don't make it so that like breastfeeding pain, slow weight gain, crying baby. When a baby is feeding, it should be good, right? Like it should feel good. And that's what I was told. But when it's not, you're almost like, what's wrong here? Like, am I doing something right? Versus really figuring out, is there something wrong?
Because, like as a new time, or not even first time mom, but just as a mom, period, for the first time for this baby, right?
Right.
Like,
every time is a new baby.
You feel like this is or at least I felt like my one mission right now that the baby is here is to feed this baby. And I can't even do that.
Yes. Exactly, right? Like, and and I mean, I already had my practice by that time. As a business owner, when you take like that, I want to be able to be at a good place as a professional, to be able to take my time as maternity leave. And majority of the parents on maternity leave, in their mind, they have, I want to make sure my baby thrives. I want to make sure my baby's happy, they're growing well. And when that is not happening, I was on a quest. I was on a mission to find out how I can be a good mom for this baby. And, having him had been a long road. I mean, it was IVF injections and all of that. And every time I would feed him, it was sharper pain than the pesky IVF injections.
Yeah.
Right? Yeah. But you don't want to say anything about it, right?
Yeah.
You want to be like, well, this is my duty.
Yeah. As you're like holding back tears.
Right. But at the same time, like, I feel like if those tears at that time or holding that like pain at that time led to, okay, at least he's doing okay.
Yeah.
That would have been even okay, right? But like when you say like he doesn't like feeding on you, or anyway, I just kind of felt like that was like such a failure type emotion. And then to see how different it was. That has made it so that I'm like, you know what? If I was really going to make an impact, I feel like being able to get this knowledge out there to other moms is going to be such a bigger, almost like
impact.
I know, but I feel like impact as well as like it's going to be life-changing for so many moms, because I still remember, I mean, years later, the frustrations, right? Yeah. So it's going to build memories for people. And majority of my patients that I see, continue to see, as my kids that I'm treating, and now like 11, 12, 13, and I saw them as babies, right? And moms and I talk about it. We still talk about it as if it was yesterday.
Yeah.
Even them, like thousands on you. Right? Thousands of stories, right? Thousands of moms, thousands over the last 15 years. I feel like we have known each other for a decade. So over the last 15 years, like thousands and thousands of time. But you do this, and then you kind of think that that's a part of your life. And then every time we go somewhere, we say something, and I say I do this, someone or the other would be like, I know someone, or someone in my family, or someone in my neighborhood. So I feel like that is something that is not discussed enough. Yeah. And so now this is the year, and you were helping me do this. I didn't know if this was going to go that way, the conversation, but.
No, that's fun. Okay, so then let's bring it back to like, okay, you're doing a TED Talk. Mm-hmm. You're focusing on teaching. And creating resources for
other providers
and everybody of the sort. Before I wrap this up, tell me what you actually do for fun.
Travel.
Tell me about that.
We have traveled all over the world, except Antarctica. But even with my son, even when he was a toddler and everything, we have traveled a lot. So this year is going to be the 20th anniversary. And last year we decided we're going to do 20 things.
Oh, nice.
Small and big
20th
trips.
20th anniversary of what?
Of wedding anniversary.
Okay.
So my husband and I love traveling. And two of us take trips together. And then we were kind of worried, like once I had my son, like how would he do? But he's done well too. If we're going somewhere, Mama, it's gonna be one plane or two planes.
Yeah.
And he like
how he knows how far out.
I know, exactly. One plane or two planes. And then he also, has figured something out. And is it gonna be sitting like this or sitting like this?
How fancy are we getting?
I know, how fancy. And then when he asked that, my husband and I looked at it and was like, he's processing. We better not do that.
Yeah.
This cannot be his normal. So, yeah, so I love traveling, planning for my travels, making sure that we are, trying to get the best of like enjoying the locations we're going to.
That's amazing. No, I love that.
That's my biggest thing.
And then if you had to share one message with the world or anything else we didn't touch on specifically, what would that be?
So I'd leave you with this one thing. Weight gain is not the only defining symptom of a feeding difficulty. If you see a mom that is having more feeds that are a struggle than an enjoyable experience, we can free up moms from guilt and make the biggest impact on their baby's life by reminding her to have their baby's mouth looked at. Take away the judgment from her and make sure we are evaluating the baby. You can probably change their life from thinking always about, am I doing this right? To, I think my baby is healthy.
That's awesome.